But in certain cases, in certain neuromuscular diseases like GBS, DMD, spinal cord injuries, or suppose if a patient is comatose, or if a person has given general anesthesia, or if a patient is sedated, wherein the cuff reflex is not active, or the strength of muscles is not enough to bring about the work of cuffing, the assisted methods to remove that cuff is required. So such assisted methods are suctioning or your assisted cuff techniques, quad assist techniques, helmet technique, or even splinter huffing cuffing, which we offer if a patient has reduced strength of abdominal muscles, or if patient has pain because of which a patient is not able to cuff out the secretions. Okay, so there are different techniques to expel out the secretions and different techniques to mobilize the secretions. Please listen to me again. The techniques to expel the secretions are cuffing, suctioning, huffing, assisted cuffing techniques, and the techniques to mobilize the secretion or to aid in the removal of secretion towards central airways are different. So what we are discussing today, or what we were discussing before the assistance, cuff assistant techniques is mobilization techniques, cuff mobilization techniques. So PD, AD, with it, what we do, we mobilize the secretion from periphery. And with huffing or cupping, or these expiratory techniques, we expel out the cuff. Okay. Are you all getting me? Are you all understanding? Am I audible to everyone? I don't think I have any network issues, but any problem with my headphones? ऐकू येतंय सगळ्यांना नीट?
Yes, ma'am. It's clear.
Yes,
Okay.
yes, ma'am.
Okay. So I don't have any PPT to share with you all now. We will be just discussing the things which you have already learned and the indications and contraindications for bronchial hygiene therapy. In the fourth year, you are supposed to write management for the particular impairment. Suppose if a patient has COPD or has cystic fibrosis, wherein the primary complaint is secretion, overproduction of secretions. There, your aim will be, your aim for the treatment of the patient is to assist in bronchial secretion clearance or to maintain airway clearance or to teach bronchial hygiene therapy. So what will be your goal for this or removal of secretion? To assist in secretion clearance, to teach effective bronchial hygiene technique. Okay. So for achieving that goal, what all different techniques can we give? That we will learn now. So your goal is to maintain airway, clear airways, or to assist airway clearance. So use these terminologies. Don't write cuff removal. Use terms like bronchial hygiene, maintaining bronchial hygiene, maintaining airway clearance, assisting airway clearance, aiding in bronchial hygiene. असा goal लिहायचा. Okay, so now write down what is bronchial hygiene therapy. Some people may call it as BHT. BHT is the short form for bronchial hygiene therapy. So what is bronchial hygiene therapy? It involves use of non-invasive airway clearance techniques, help to mobilize and remove secretion. Okay. So what is it? You want to write down?
Yes, ma'am.
Yes, ma'am.
Yes, write down. Uma or Rutuja, anyone, just unmute yourself and tell me when you finish writing. Yeah. Any one of you. Just unmute yourself and tell me.
Repeat it once.
Yes. Okay. So bronchial hygiene therapy, it is the technique, or it is the use of non-invasive airway clearance method. It is the use of non-invasive airway clearance method to help mobilize and remove secretions.
Yes, ma'am. Done.
Okay. Now, can I just ask, what is this mucus? Where is it produced? What is the composition of mucus?